video is to demonstrate how to do a dressing using Santyl. Here is your wound. So the first thing you would do is take one of your super fluffs, moisten it with the Gauze, squeeze out the excess, place it inside the wound bed, let it sit 3 to 5 minutes. Remove that, toss that, change your gloves. Before packing a wound, you should always probe it to make sure where your dressing is going to go. So what you want to do is see if there's any undermining, which we have undermining, or if there's any tunneling, which we do have tunneling. So you want to do that prior to your dressing. So now that you've determined you have undermining, so now to get ready to do the Santyl dressing. Santyl is an enzymatic, as we all know, and it only works when it is activated by moist gauze. So what you're going to do is fill this wound bed, the entire wound bed. It won't hurt the good tissue. It will only eat the bad tissue. Try not to get it on the peri skin because it will make your Methylex hard to stick. It will not hurt the skin at all. However, it will let your adhesive stick. So what you want to do is put nickel thick Santyl in the wound bed. If it's not nickel thick, you've kind of wasted the ointment. It has to be nickel thick, opaque. If you can see through it, you don't have enough Santyl. So fill the wound with Santyl. You can either do it this way into the wound, or with your Gauze moistened gauze, you can put it on the gauze itself and pack it into the wound. So to prevent our Seymour butts from getting injured, we will not do the actual steps. I would just talk through it again. So you have cleaned your wound. So now you're going to use no sting skin barrier. And you want to open this and paint the peri-wound skin. And what that does is protect the good skin from any drainage and the adhesive that you're about to put on this patient. Let that dry for 1 or 2 minutes. Then you're going to again apply Santyl in the wound bed. Gauze moistened gauze, squeeze out the excess. You don't want it soaking, dripping wet. Then you are going to pack your wound loosely with the fluff. So idealistically, you will open it all the way, and this is moistened with Gauze, okay? Then you're gonna take a clean Q-tip. Your wound is full of Santyl, and you're gonna start as such. And you're gonna start with the undermining to make sure you get contact of all the skin with the moistened gauze. Now, if you remember, there's a tunnel there, so you take an edge and make sure that that gets into that tunnel as well. Loosely packing and making sure that the gauze comes in contact with all of the open tissue. Make sure that it's not on his good skin. It will macerate it. Okay. Then when you're done there, you will take your Methylex. You will date it today's date, the time in which you did the dressing, and your initial. You will, as we know, remove the backing. This is how you place it down, smooth it out, and move your wings here. And you have now completed successfully a Santyl dressing. Please document in the flow sheet.